Yes. Yes. Yeah. Okay. At this time, Dr. Joyner will read the decision of the executive committee.
Thank you. Can somebody please?
Okay.
Okay.
At this time, Dr. Joyner will read the decision of the executive committee.
Thank
Oh.
All right, proceeding, because this is a needed service in this area of Mississippi, we have voted to approve this request.
Dr. Burt, Gerard, can I have Dr. Burt back up, please?
Thank you.
Dr. Burt, this is Ken Cleveland, the Executive Director for the Medical Board. I just want to make sure you understand the collaboration rules for Mississippi, which includes chart checks and quarterly reviews.
Yes.
All right, thank you.
All right, so at this time, we're gonna make an amendment to our agenda just in order to facilitate the rest of our meeting. And so we are going to now move to item number 4 on the agenda, which is the Zoom appearance of Dr. Cody Vassar. And we will then go back to item number 3, the Zoom appearance of Dr. Sweet.
Morning.
Good morning.
How are you guys?
We are doing great. Thanks for being with us this morning. Dr. Vassar, if you'll just kind of tell us a little bit about why you're here to see us this morning.
Sure. Kind of similar to the last request. I was looking to be granted an exception to the distance requirement for NP collaboration. I'm also a psychiatrist, and I was looking to collaborate with a recently graduated nurse practitioner that will be doing general psychiatry, both in person and virtually. I'm a adult psychiatrist, but in the state of Wisconsin, but I work in Mississippi part-time, doing telepsychiatry.
And so tell us a little bit about the work that you're doing in Mississippi already.
Sure. So I essentially do general outpatient psychiatry through a platform called Talkspace, which includes more mild psychiatric conditions, no controlled substances. So I guess anecdotally, most of the patients I see come from Gulfport or Biloxi, and so treat a lot of anxiety, depression, some milder and mood disorders, but generally, not that it precludes people from schizophrenia or any other major conditions. It's just this is mostly a more of an insured population. They will be adding Medicare soon, so it might expand some of that availability soon. But as of right now, it's been mostly like private insurance.
So can you help me to understand, is Ms. Chandler going to be an employee or work with you through the Talkspace platform, or is this going to be something separate or independent from that?
It'll be independent from that, ma'am. She has started her own psychiatric practice. It's called Safe Touch and Mental Health Services, and that will be separate from what I'm doing. And she won't be working for me specifically.
Okay. Do we have Chandler available? Is Chandler here? Is she here?
Right, do we have Ms. Chandler on the line as well?
I don't think she was, when I received the notification to be present for this, I don't think they referenced her or required her to be present. I'm not sure if that was communicated to her or me. It was certainly not to me.
Doctor, how'd you meet Ms. Chandler?
Through an intermediary, through a collaborative, like Facebook group.
And do you understand the collaboration rules of Mississippi?
Yeah, 20% chart reviews and quarterly meetings.
Those meetings are to be educational in nature.
Mm-hmm.
Hey, this is Tom Jordan. It sounds like your practice is on the coast. Can you tell me exactly where it is?
I mean, so
Will it-
it's accessible to everyone it covers everyone in the state of Mississippi. I'm just, from recollection of the majority of the patients that I can think of off the top of my head where they come from, I would say that, Biloxi and Gulfport are the two that are most, frequently come to mind.
So, can you tell me a little bit more about the Facebook group or the social media group that kind of put you two together? Is it a people interested in psychiatry group? Is it?
Yeah,
Or
it's
is
a
it?
sorry to interrupt you, ma'am. It's a psychiatric nurse practitioner group. And I collaborate with a nurse practitioner here in Wisconsin, and she was, acquainted with this person or friends with them, I should say, and said that she was in need of a collaborator, had been looking for a while. So she reached out to me and we discussed and kind of made sure that her goals aligned. And I facilitate a lot of rotations for students, for NPs and PAs and medical students. And so I like teaching. This isn't necessarily this isn't actually at all financially driven. It's mostly just, she's a new nurse practitioner. I guess sort of anecdotally, and where I live in Wisconsin, I have a lot of patients that travel between different parts of Mississippi and where I practice. And so that's kind of what like put me onto it. That's kind of part of the reason I pursued licensure in Mississippi. And so I work part-time in Mississippi through the telemedicine, but I also work part-time in Wisconsin. And so I do have patients that travel between the two places, and when they go there, they often don't have psychiatric care. And as of right now, I don't have a way to like directly facilitate that for them. So this is a little bit a way of helping me as well.
So do you practice telemedicine in any other states besides Wisconsin and Mississippi?
Yeah, I in Pennsylvania and New Jersey, I do inpatient and well, not inpatient, but inpatient consults and emergency department consults for a hospital system in the East Coast.
Oh, hi, Dr. Besser. I'm Ken Lippincott. I practice psychiatry in North Mississippi.
Hello.
And you said that Ms. Chandler. Sir, Chandler, is that right?
Yep, correct.
You said that she's a recent graduate. How recent?
Within the last year.
And can you tell me a little bit about her qualifications?
I don't have them on hand. I know that she recently completed her PMHP, or primary mental health nurse practitioner certificate. I know she was a nurse for several years before that. I guess I don't have her resume on hand. I can look it up, but I can.
And do you know which program she graduated from?
I don't have it off the top of my head. I'm sorry. It's not, I would say that it's not a nationally recognized program. It's not a major institution.
Her address is
Maven.
Safe Touch, and then is she in a clinic with other practitioners, or
No, so this is all to be developed. She isn't practicing yet. This this is her plan. Contingent on having a collaborator.
So
Hmm.
what is she doing clinically, at this juncture?
She's still doing bedside nursing.
I'm a little confused. You say this hasn't started yet. So she hasn't practicing, but you know that most of your patients have been coming from the coast. How does that work?
Oh, I guess my patients are coming from the coast, not hers.
Okay.
I guess my concern is, you know, I was, it's about a recently graduated nurse practitioner being in a clinic by herself, she's seeing general psych patients, or, you know, she's planning on seeing adolescents as well, or children.
No adolescents.
18 and up.
Mm-hmm.
Yeah.
And is
I mean, I
the-
guess your concern is, you know, part of the reason that I think she needs someone that's dedicated to teaching and not just being sort of a presence. But this is sort of, you know, not to be political, but this is sort of the state of, you know, nurse practitioner practicing rights and things like that. And so I think they're much more qualified and devoted to providing her the guidance that she needs to provide safe care than, you know, I mean, I am out of state, that is correct, but, you know, to be completely honest, there are a lot of places where people have, you know, signatures for supervision, but they don't actually have true collaboration and supervision where they're being taught and directed and whatnot, at least from what I've seen so far.
So is Miss Chandler, is she planning on doing face-to-face practice, or is she planning on doing telepsychiatry as well?
I think her initial plan is to do in person, but also offer telepsychiatry as needed. I've given her some sort of guidance on that, and that I don't think she should do completely telemedicine, at least to start, or you know, until she has more experience. But you know, telemedicine has its ups and downs, and I think that. But to start with, I think she should focus on building a in-person practice.
As I understand it, this is going to cover the entire state.
I'm sorry.
It says, I understand it, this is going to cover the entire state.
Well, I think that you know, her catchment area would probably be the entire state, but I think if that's why I was telling her to focus on in person, because that would kind of concentrate her to more of her local area.
How are
You
you
know,
received? How do you come upon your patients? Is it listed in the phone book? Is it listed?
it's so my patients specifically are through, so it's a sort of a work benefit program. So it's listed as a approved sort of provider for someone's insurance plan. So like some of the major, like Cigna, et cetera. And so instead of trying to find, it's kind of like sublisted on approved insurance providers.
It's going to be statewide when you get up and running.
Well, I work for an organization, and which is, you know, different than what she's going to be doing.
Yeah,
They're separate.
yeah, I have worked in that area, and I know that there is a need for psychiatric services. There's some.
There was a hospital closure, to my understanding, which has diverted a lot of people away. So there are a lot of people looking. I mean, and also, I mean, not that there isn't a shortage of psychiatry in any area, but you know, out of the places that I work, Mississippi certainly has a higher need, at least in my opinion. I don't have the data to support that than many other states do.
Well, but you would need to work. Has she had experience as a psychiatric? I mean, I guess that my concern is, I mean, how are you gonna communicate and collaborate with this new practitioner.
Sure. And the same way, my plan was to do in the same way that you do residency, you know, you do staffing after you see patients. You know, she's not gonna be able to, you know, she's not gonna be doing 10 intakes a day or anything of that nature. So, you know, in the same way that we're having facilitating this meeting, which I think runs well, I think we'll be able to, you know, staff her cases after they've been done. And once we move her through a period where she's, you know, demonstrated that she has the capacity to, you know, reach certain appropriate treatment guidelines, et cetera, you know, then we'd probably space it out a little bit, but.
Okay, thank you.
Now, you say the services that you're gonna offer are gonna be depression and such as that. You're not gonna be dealing with schizophrenia and major psychotic illnesses. Is that correct?
That's his practice.
That's what I do. I think that if she's gonna do a local practice, my suggestion to her as to provide the most benefit, which is basis of me doing this, is for her to get experience doing those things. And that's why I think she needs a good collaborator. She's probably not, you know, managing basic anxiety, depression is something I think she'll be able to reach more quickly than, you know, managing serious and chronic mental illness. But that's different than what I do from a telemedicine standpoint in the state of Mississippi.
I understand that. But what is she gonna be offering?
She's going to be offering general, you know, adult psychiatric mental health care, which would include anxiety, depression, mood disorders, and schizophrenia.
So it will include major psychiatric illnesses.
Mm-hmm.
Any additional questions? And if not, is there a motion?
I would like to make a motion that we go into executive session to discuss this case.
All right, so it's,
I second the motion.
so it has been moved that we close the meeting
Oh,
to
close, sorry.
consider whether to go into executive session. Is that the motion that you were
That's
seconding?
it.
All right, that's been moved and properly seconded. Any further discussion?
Nope.
All in favor?
Aye.
Aye. All right, it's unanimous. We don't have to ask about nays. got the same shirt on.
He's got a screensaver on.
That's sure.
Possibly here.
Dr. Vassar, are you there? Are we muted?
He's muted. Dr. Bass is muted.
Hello.
Yeah.
It is the same truck.
Hello.
Hi there. Okay, we're back in open session and Dr. Joyner is gonna read the determination of the executive committee.
The executive committee has decided to approve this request with restrictions on the collaborative agreement. There are no controlled substances prescribed until approved. Chart checks are to be sent to the executive director on a quarterly basis. And 80% of all visits initially are to be face-to-face in person. And if any discussion is needed, you can contact the executive director, Dr.
Next
Ken
week.
Cleveland.
Next week.
Next week.
Next week.
Okay, very good. Thank you very much for your time.
Thank you.
Thanks, Dr. Vassar.
I feel like I love. Next, we are going to move on to our final appearance of the day, which is a Zoom appearance by Dr. Salika Sweet. Dr. Sweet, thank you for your time and for your willingness to deal with us while we made the amendment to our agenda.
Do I need to officially recuse myself?
Yep.
You may,
I
yes,
will
sir.
recuse myself because of a working situation that I have with the next.
Sounds good. All right. So at this time, we have the interim Dr. Joyner, also known as Dr. Kennard, who graciously agreed to step in for this matter. So welcome to the wonderful world of secretariathood. All right. Good morning, Dr. Sweet. Can you hear us? Oh, you're muted, I think, or at least we can't hear you.
Okay, yes. Can you hear me now?
Can hear you now. Perfect.
Okay, great.
All right. So, you can, if you would, please just go ahead and summarize your request for the executive committee.
Okay, well, I'm a board certified family physician. And as of November the 13th, I am no longer employed at Merit. I worked there for 27 months. I was also employed at the same time by the Veterans Administration. So I've been working approximately 7 days a week for the last 2 years. And I'm actually tired of it. And I'm just going to do the VA now, the Veterans Administration. I am the medical officer on duty at the Tuscaloosa VA. What that means is that at any veterans hospital that does not have an emergency department, they have to have a physician 24/7. So I work their WIN hours, which is I work Saturdays and Sundays, 7 a to 7 p. I have been collaborating with Molina and Matrix, and I will no longer be working a clinic job. So if you think about it, I have worked, the requirement's 20 hours a week, and I have, for the last two and a quarter years, I've done much more than that clinically. So therefore, I'm asking the board to approve me that my VA in Tuscaloosa stands for that 20 hours. And the reason I'm working Tuscaloosa VA and not GV Sunny Montgomery VA is that I like the position as the medical officer on duty. And since GV Sunny Montgomery VA has an emergency department, they do not have that position as a medical officer on duty.
And And so this is actually just a request as it pertains to your collaboration with a nurse practitioner through both Matrix and Molina, correct?
Correct. And my job with Melina and Matrix, the nurse practitioners are not treating anyone. They're just doing assessments.
And can you speak a little bit more about that work? So you currently are active, but because of a change in your clinical status, you've now requested a waiver. Is that where we are?
Correct. Yes.
And what kind of assessments are the nurse practitioners performing?
They do assessments of the treatments that the patient. I have to go back between patients and veterans, so excuse me. They've been doing the assessments of patients as far as their blood pressure, their temp, are they diabetic? What's their hemoglobin A1C? What's their vaccine status? And if there are any concerns or abnormalities, they follow up with their primary care provider. And so I review their charts. They also review what vaccines have they received. We go along to the United States Preventive Service Task Force as far as the guidelines. So if they're of the age where they get a bone density scan, we check to see if they've received that. Have they received the pneumococcal vaccine? So it's just a lot of assessments. There is no treatment.
Any other questions?
Hi, Dr. Sweet. I'm Ken Lippincott from Tupelo, and so you're actually still living in Pearl, is that correct?
Oh, I live in Pearl, Mississippi. This has been my permanent residence for 26 years. I have a daughter who's in Bay St. Louis, a son who's looking at moving to Gulfport. We're looking at building a second home on the Mississippi Gulf Coast. And I'm about 6th generation Mississippi, 6 or 7. I'm from here.
So you're just requesting an exception to the practice rule for Mississippi, right? 20 hours in the state.
Right, correct. And actually, I work urgent care. I've worked emergency rooms off and on for 30 years. And so, I mean, I could still possibly be picking up shifts here and there, but I'm going from part-time permanent to full-time permanent with the VA. I was full-time permanent, and I took this job at Merit and I became part-time permanent. Now I'm going back full-time permanent with the VA Tuscaloosa, but my home is in Country Place subdivision by the airport in Pearl, Mississippi. This is my permanent residence. And
will you be meeting with these nurse practitioners face to face for your quarterly meetings, or by virtually, or what?
These calls Molina and Matrix have set up. They have set up Zoom calls. However, 2 of the nurse practitioners on the Mississippi Gulf Coast, Tamika Dito and Louise Usher, are female veterans. I worked in women's health as the champion and director for 10 years. I worked on the coast 4 years in women's health. I actually know these nurse practitioners very well via the women's clinic. And also 2 of the nurse practitioners that I'm working with Matrix, I actually was her preceptor at the VA when I was in women's health. So I work with these virtually, but I actually know them professionally. And now I've known Vintasha. I worked with her at Family Healthcare in Pearl, where I worked for 9 years. So
but you haven't been their physician collaborator previously?
Well, I have been Prince McClinton's collaborator at the VA in the women's clinic. I was her nurse yes. So I know her extremely well.
So how many nurse practitioners are you requesting exceptions to collaborate with?
Melina, there's two that I'm on the record for, but I'm only actually one is what I'm collaborating with because she's also licensed in Illinois. And so what Melina does, even though Melina's actually doesn't have many. And so these nurse practitioners, some of them are licensed in other states. So even though I'm on the record as their nurse practitioner, they might not be doing assessments. So for Melina, there is one well, I'm two on the books as far as listed under Mississippi Board of Medical Licensure. And like I said, I know them well, extremely well. And with Matrix, there's nine. And one of them I have worked within the past 4 years. I was her collaborator at the VA for about 2 or 3 years. And one of the other ones, I worked with her at Family Health Care. So these are, I'm just saying, I know some of them very well.
I'm sorry, I'm a little confused. Is Matrix that have anything to do with, so you're collaborating with nurse practitioners with the VA, and is Matrix totally separate?
No, no, no. Let me give you a little bit of my career. I worked in women's health. I have worked with the VA for 15 years. I'm still employed at the Veterans Administration Hospital. I was working part-time. I was working full-time. In order to do this, I went part-time and worked at Merritt Hospital. I'm now no longer working at Merritt, and I'm going back permanent at the VA. I'm a medical officer on duty
What
at the Tuscaloosa VA.
what is
But
Matrix? What is Matrix?
Matrix and Molina are very similar. They're insurance companies, and within the insurance companies, they have nurse practitioners that go out and do assessments, or they do them telehealth or face to face as part of their insurance that they have.
Okay, thank you.
Anything else? Any other questions? If there are no other questions, then I will entertain a motion.
So moved. Second.
Wait, somebody's got to state what that would be. So what would the motion be? Would you like to close the meeting? Consider whether to go into executive session?
That's exactly what I'd like to do.
Okay, so that's been moved. Is there a second?
I'm a second.
Okay, any further discussion? All in favor?
Aye.
Aye. No need to ask. All right.
Years. I guess, for example. The fact is, she's got all of them. Just mentioned Lena, there's nature, she has to heal because she's now dropping below.
All right, we're back in open session and Dr. Interim Joyner. Dr. Kennard is gonna read the decision of the executive committee.
Okay. Dr. Sweet, thank you for joining us to clarify everything. The executive committee has met, and after much thoughtful consideration, we're going to request your exception to the 2080 and the mileage rule for the purposes of your collaboration.
So the request was approved.
The request is approved, yeah.
Thank you.
Unscripted.
Dr. Sweet, this is Ken Cleveland. I'm the executive director here at the medical board. If the situation were to change and y'all were to go beyond assessments, the board would want you to represent, please.
Yes, Dr. Cleveland, I understand.
All right, thank you.
Thank you.
Have a great day.
You too.
All right. All right, guys, anything further? Because that concludes our scheduled agenda items. Yes, Dr. Lippincott.
Are we gonna request a report from Dr. Cleveland?
Well, yes, that would be lovely.
So I continue to meet with the PHP on a monthly basis to review participants. And we do it upon our request and upon their requests. And I will actually ask later to speak to the full board about those meetings. We've had several meetings with licensees, sometimes problems with prescribing, sometimes trying to get to resolution and to a consent order. And so there was a numerous number of those. I don't remember how many right off the top of my head. Over the past 2 months, we've had a lot of them. And so all that, the typical work of the executive committee, of the executive director. And I will go ahead and steal my own thunder for my executive director's report to the full board and let y'all know that I was reelected treasurer of the IMLC yesterday to serve as another year, as treasurer. So that's
Fantastic. Thank you.
congratulations.
Indeed. Congratulations.
Thank you.
All right. So anything further? All right. Well, in that case, the meeting is adjourned and we will reconvene in what, 10:15 or 10:30?
I think 10:30.
10:30.